The year is 1932. The Great Depression has broken the back of America. Banks are closed, farms are failing. Men who once had names now have numbers. Breadline numbers, relief numbers, the numbers of people the system has stopped seeing as people. In Macon County, Alabama, the situation is worse than most. This is the poorest county and one of the poorest states in the nation. 8 in 10 residents are black. Most are sharecroppers. Most have never seen a doctor. Most have never expected to. Into this place, in the autumn of 1932, came men in white coats. They came with a promise: free medical care, free meals on examination days, free transportation, and, in the event of death, a burial insurance policy. $50 paid to the family. In Macon County in 1932, $50 was not a small thing. In Macon County in 1932, the word free, attached to the word doctor, was not a small thing. The men in white coats were from the United States Public Health Service. The study they were recruiting for had a long clinical name: the Tuskegee Study of Untreated Syphilis in the Negro Male. Note the word untreated. They did not tell the men that word. The study was designed by Dr. Talia Farrell Clark, a senior officer in the Public Health Service. His original proposal was, on its face, a piece of legitimate science. Syphilis was devastating rural black communities in the American South. Existing studies, conducted largely on white populations in Scandinavia, had tracked the long-term progression of untreated syphilis, but no such data existed for black men. Clark's proposal was this: recruit a group of black men already infected with syphilis, observe them, study the disease's progression through their bodies over time, contribute to medical knowledge. It was, he believed, a 6-month study. It lasted 40 years. Clark departed the project before it truly began. The study was handed to Dr. John Heller, and then to a succession of Public Health Service directors, each one inheriting the project like a lease, each one renewing it without serious examination. But the Public Health Service could not do this alone. To recruit men in Macon County, black men, poor men, men who had every reason to distrust the federal government, you needed a name they already trusted. You needed an institution. The Tuskegee Institute was one of the most important black educational institutions in America. Founded in 1881, built by its own students, literally, physically, brick by brick. A symbol of what black Americans had constructed in defiance of a country that preferred they construct nothing. The Public Health Service chose it deliberately. The Institute lent the study legitimacy in the eyes of the community. It provided facilities. It provided the local connection that Washington could not manufacture from a distance. And it provided something harder to name, a kind of moral cover. The reasoning, spoken or unspoken, was this: if Tuskegee is involved, it cannot be against us. The Institute's leadership agreed to participate. They were not told everything, but they knew enough. This is one of the study's most painful dimensions, and one of the least discussed. The machinery of this deception did not run only on white institutional power. It ran, in part, on the borrowed credibility of the most respected black institution in the South. That was not an accident. It was architecture. The men recruited, ultimately 399 men with syphilis and 201 controls without it, were never told the true nature of what they had joined. They were told they were being treated for bad blood. Bad blood was a local term. It covered fatigue, anemia, various ailments. It was a phrase that meant something real to these men in a colloquial sense, and nothing precise in a medical one. It was chosen for that reason. The men were given physical examinations. They were given aspirin. They were given iron tonic. And when the researchers needed to study the progression of the disease inside the men's bodies, they were given spinal taps. The men were told the spinal taps were a special free treatment, a treatment they were lucky to receive. In 1947, penicillin became the standard cure for syphilis. Widely available, cheap, effective. The men in the study were not given penicillin. The Public Health Service took active steps to ensure they could not access it elsewhere. The study was not a study of untreated syphilis anymore, not in the way Clark had originally conceived it. By 1947, it had become something else. It had become a decision, a deliberate decision, made annually, renewed without protest, by educated men in government offices, to allow 399 human beings to suffer and die from a curable disease, in the interests of data. The study did not run itself. It required infrastructure, it required local trust, and it required, critically, a face that the men in Macon County would recognize, a face that looked like theirs. That face belonged to Eunice Rivers. Nurse Eunice Rivers was a black woman who had grown up in the South, trained at the Tuskegee Institute, and understood, with painful clarity, the texture of life in Macon County. She knew the men, she knew their families, she knew the roads to their houses and the names of their children. She became the human constant of the study, the one face that didn't change as directors rotated through Washington, the voice that called the men in for their examinations, the woman who drove them, the woman they trusted. Historians have argued and continue to argue about Eunice Rivers. She was not the architect of what happened. She did not design the deception. But she maintained it. Year after year, for 4 decades, she maintained it. She maintained it because she believed, or told herself she believed, that the men were receiving something: free examinations, rides, a meal, community, the burial insurance, something. She maintained it because she was a black woman in the American South in the 1930s, the 40s, the 50s, working inside a system that held every card. She maintained it because the system was very good at making continuation feel like the only reasonable option. The system was also good at silence. Between 1932 and 1972, the study was never secret. It was published. 13 papers appeared in peer-reviewed medical journals during that period. Papers that described, in the dry language of clinical observation, what was being done to the men of Macon County. Doctors read those papers. Medical students read those papers. Nobody stopped it. In 1966, a Public Health Service employee named Peter Buxton read a summary of the study and wrote a formal protest to his superiors. He was told that the study would continue. He was told the matter was closed. He was not satisfied. He waited. He gathered. And in 1972, he gave what he had to a journalist. Her name was Jean Heller. On July 25, 1972, her story ran on the front page of the Associated Press wire. By the next morning, it was everywhere. The study was terminated in November 1972. By that point, 28 men had died directly from syphilis. 100 more had died from related complications. 40 wives had been infected. 19 children had been born with congenital syphilis. A Senate subcommittee convened. Hearings were held. A class action lawsuit was filed on behalf of the survivors and their families. In 1974, the federal government settled. $10 million, divided among the men, the living ones, and the families of the dead. The men received lifetime medical benefits. Later, their widows would too. These were not presented as admissions of guilt. The government was careful about that. In 1997, President Bill Clinton stood in the East Room of the White House. Several of the study's surviving participants sat in the front row. Herman Shaw was 94 years old. Clinton looked at him and said, "What was done cannot be undone, but we can end the silence." Herman Shaw stood and spoke. He was dignified. He was gracious. He said he hoped the apology would help the nation to move forward. 5 of the 8 surviving participants attended the ceremony. The other 3 were too ill to travel. The last known survivor of the Tuskegee study, a man named Ernest Hendon, died in 2004. He was 96 years old. He had lived with the knowledge of what had been done to him for 32 years after the study ended. He had lived with the effects of it for longer than that. The Tuskegee study ended in 1972, but it did not end with itself. In the decades following the exposure of the study, researchers began to document something that would come to be known, quietly, carefully, in the language of public health, as the Tuskegee effect. It worked like this. Black Americans, particularly black men, had become significantly less likely to seek medical care from government health programs. Not because they were irrational, not because they were ignorant, because they knew something. A 2016 study published in the Journal of Medicine and Philosophy examined this effect across decades of data. It found a measurable, documented reduction in life expectancy among black men in the counties most exposed to news coverage of the Tuskegee story. The researchers estimated that the distrust generated by the Tuskegee study may have been responsible for as many as 150,000 excess deaths among black men in the United States. Let that settle. Not the men in the study, not the 431 participants. 150,000 people, men who did not seek the care they needed because the American government had taught their communities through 40 years of deliberate, documented action that seeking care from the government was not safe. When COVID-19 arrived in 2020, public health officials were confronted again with a crisis of trust. Black Americans were contracting the virus at higher rates, dying at higher rates, and, when vaccines became available, hesitating at higher rates. Officials expressed frustration. Some expressed surprise. They should not have been surprised. The hesitancy was not irrational. It was inherited. It was a rational response of communities that had been taught by their government across generations that their bodies were available for use, and that the people in white coats did not always come with their interest in mind. The United States government spent 40 years lying to 399 men. Those 399 men had wives, children, communities. Those communities had the next generation and the next. The wound did not close when the study closed. The wound did not close when the president apologized. Wounds of that kind do not close on the schedule of the people who made them. 399 men. They had names. They had names.